This next movement is to help facilitate a little bit more of a lateral lunge or hip abduction. This is for someone who's getting any pain, pinching, compression in the front of the hip, or someone who's just trying to isolate hip mobility without it pulling at their lower back or at their pelvis. So I'm going to take this band behind me. I'm going to walk forward so I have a fair amount of tension in the band. And I'm going to start off with a little bit of space between my feet. So here I have a little bit of a forward lean to stop myself from falling backwards. And if it's too much pull, I can hold a chair or a post or a stick in front of me. So starting off here, I'm going to try and make sure my pelvis is tucked underneath me. And it may be a good idea just for me to show this, holding on to something. So let me just grab this post real quick. All right, so this could be in the form of a broomstick. So once again, foot through the band, up into the groin, walk away to get some tension. I'm going to hold the post. This is going to allow me to work on making sure that my back is not falling into this hyperlordosis or anterior pelvic tilt. Feet apart, I'm going to lightly press down into the post to pull my pelvis underneath me as I just let one knee bend, letting this leg drift into some abduction, trying to decrease any pressure, compression, pinching that I was getting on the front of this hip as I rock out of it. So I want to get as much space between my feet as comfortable, and then just very slowly going towards this left knee. This knee stays pretty straight as I'm trying to work this hip into some abduction. I use the post, and if anything, I try and drive my hands down into the floor to pull myself into more of a posterior pelvic tilt as I slide over. Now you'll notice this knee that's bending, I'm trying to minimize how much this knee crashes forward by sitting onto this heel and pulling this knee just a little bit outward to where my toes are as I drop into this hip abduction stretch. I can also just keep this band on here if this is my problem hip and do the other side. Same thing, this band is hopefully minimizing any irritation or increase of muscle tone that my hip flexor might produce by having that deep pressure against it. So I can go side to side, or if for whatever reason it hurts me to go towards this bent knee, I may just start off going bent knee the opposite direction.